So this is the lecture that goes with the lower limb bones. This is pretty much the presentation I gave in the lab class when you had the bones with you. But this lecture will take a photograph of the bone and show you where all the landmarks are, as well as how to tell right from left. So the bones of the lower limb are the os coxa, and the two os coxa plus the sacrum make the whole pelvis. From the os coxa, we have the femur, the patella, the tibia, the fibula, and then I did all of the bones of the foot as one slide. So let's start with the pelvis. I said that the pelvis consists of both os coxa, the right and the left, as well as the sacrum and the coccyx. So the pelvis is the whole piece put together. Within the pelvis, there's regions called the true pelvis and the false pelvis, and then the opening, the outlet, and the subpubic angle. So here's a photograph of a pelvis from class. I said from the pelvic brim. The brim is this region right here. From the brim and superior to those pieces of the ilium, we refer to that as the false pelvis. It goes all the way to the top of the iliac crest. The true pelvis is from the brim all the way down to the ischial tuberosities. The basic difference is the false pelvis is open anteriorly. All your abdominal organs are sitting there, your digestive organs, and it is open anteriorly. Versus the true pelvis is pretty much entirely surrounded by bone. And I pointed out that the pelvic outlet is between the two ischial tuberosities at the bottom. And then I have this picture of the pelvis. This is a different pelvis than the other one. And the key to this one is this subpubic angle. And remember that the subpubic angle is this space under the pubic symphysis. When we talk about the pelvic opening, that's the brim again and around. And I outline that with this bright yellow circle to show you the around. And then the pelvic outlet between the two ischial tuberosities, but if you're looking straight down, you can't see those. So instead you use the two ischial spines. How far apart, how wide are they? How wide apart are they? And that is how we determine the gender of a pelvis. What is it, female or male? So let's look at those rules. Now your textbook, or your lab book rather, not the textbook, has a nice list of about 10 things on page 154 in the lab book. But I'm distilling it down to the 3 key elements. If you can find these 3 key elements, then you can determine whether or not it's male or female. And the first element is the subpubic angle. If that subpubic angle is less than 80 degrees, it's male. If it's greater than 90 degrees, it's female. And this is where I said to use your hand to measure it. 90 degrees is an L. If you make the L shape, that is 90 degrees. Some people say use other things, but that's more than 90 degrees. L is 90 degrees if you make that L with your hand. And if you're trying to do subpubic angle less than 80, make the V with digits 2 and 3. The rabbit ears you see in photographs, that V is about 70 to 80 degrees. So that will tell you male versus female. The inlet versus the opening. So in the male, it's round, and that's where I showed how you can use your fingers to lock and rotate to determine if it's round. In the female, it's oval. I said in the male, the pelvic outlet is narrow versus the pelvic outlet is wide. Now, the way you measured that, I said, was make a fist and determine would your fist go through there. If your fist does not go through, it's male, it's narrow. The female pelvic outlet is wide enough for even large hands to go through. If you want to check out the other differences, they're there. So here I'm making the comparison. The male, I've drawn the circle. It's pretty much round, showing how that circle fits into between what we call the sacral prominence at the sacrum. That's here where I'm putting the red line to the pubic symphysis. Okay, it's not perfectly round, but it touches the edges of that pelvic brim. We see that the subpubic angle very much is less than 80 degrees. If you were to use your fingers, that would be a perfect V right there. And the distance between the ischial tuberosities is very narrow. If you try to put your hand through there, even just looking down into this pelvic inlet, you can see that your hand is not really going to fit through there. If it's a fist, you're going to hit those coccyx bones. Versus the female pelvis, I use the blue. See how oval it is? She's much wider across. So the pelvic opening is oval. Her subpubic angle here is definitely greater than 90 degrees. That's where you make the L, and it's a perfect match. And her ischial tuberosities are wider. Now imagine trying to put your fist through this. You could easily see that there's space for your hands. Her coccyx bones are tipped back a little bit more. You're not going to hit them. There's definitely room for childbirth because all of the differences are based on childbirth. Let's look at the Os Coxa. Os Coxa literally means the bone of the hip. Os meaning bone, coxa meaning hip. And what we're looking at is the medial view, and you can tell because you do not have an acetabulum. I told you the great story about the acetabulum. And what we see is that this is 3 bones all connected. The ilium is the superior portion, the ischium is the inferior portion, and the pubis is anterior. And the lines I've put in there show you where the bones basically separate. All 3 bones join at the acetabulum, and then the halfway down the ramus of the pubis is where the ischium starts. So it's halfway through there, which we'll look at the lateral view in a second. Whoops. Those got out of order. Okay, let me do this piece. So if we're looking at the whole pelvis, the Os Coxa has joints. And the first joint we see is the sacroiliac joint. This is where the ilium, I-L-I-U-M, joins the sacrum, hence the name sacroiliac. It is a synovial planar joint, and it is movable. The second joint that the pelvis forms is the hip joint, which is with the acetabulum here with the head of the femur. Now, technically, the junction, the pubic symphysis junction, is a cartilaginous symphysis joint, which we did in the last unit, so I'm not going to stress that one very much. But we're looking at sacroiliac is what we call the axial appendicular joint, meaning this is how we attach the lower limb to the axial skeleton, the sacrum. The hip, though, is kind of like the shoulder joint. It is appendicular to appendicular. Like the shoulder joint, it is a ball and socket joint. Okay, let's look at how do you tell right from left Os Coxa. And what we see is that the iliac crest is superior. That's this piece up here. So we have to have that on top. Iliac crest is superior. The acetabulum, which is the orange arrows, I've labeled it on one side, but it's the orange arrows on both sides, is lateral because it makes the hip joint. And then this pubis is anterior. I said you could also use the greater sciatic notch being posterior, but it doesn't always show up in all the photographs. You can definitely tell that this pubis is anterior here. So I've actually put them right and left correctly as if the person is standing in front of you, so they are anatomically correct. Let's talk about landmarks for a moment. So if I'm looking at this medial view, what do I have for landmarks? It's actually labeled on the bone with a sticker, is the iliac fossa. This is the origin of iliacus. It's the bowl-like structure. So this is the iliac fossa. The iliac crest runs across the top. This is what you put your hands on. If you put your hands on your hips, you are putting your hands on your very own iliac crest. I stressed in class the anterior superior iliac spine, which is at the end of the iliac crest, and then there's a little dip, and inferior to it, you have the anterior inferior iliac spine. Both of those spines are very important to note because they are the origins of different muscles. The greater sciatic notch is this notch that looks like you could put your thumb into it. It's called greater sciatic notch because the sciatic nerve comes through there. There is a lesser. We're not going to worry about it. We just need to know the greater sciatic notch. We have the obturator foramen, which I mentioned in the neural lecture. The only thing that goes through the obturator foramen is the obturator nerve, but it's a hole, so we call it a foramen. We have the ischial spine, which is just one there on the part of the ischium, and then of course the pubic symphysis surface, which is where we get the pubic symphysis joint. I look at the lateral view. Now remember, we don't really, when I photograph these, I don't really do anterior posterior. I usually do medial lateral because it's how the bone tips. And the key with the lateral view is you are looking for this acetabulum, that vinegar bowl. That is your cue to where the hip joint is. We have the superior and inferior ramus. And then we have this ischial tuberosity, which when I talked about muscles, is the origin of all your hamstring muscles. If I tip it so we're looking straight at the posterior, you have the gluteal lines. Now because this bone was tagged for it, I did label them individually. However, on the test, if I said, what are these lines called? The group is the gluteal lines. Or if I said, what muscles originate from this group of lines, it would be the group called the gluteal muscles. I did put back in the iliac crest just for reference. That was on the previous slide, but I kept the same number. It was B before, it's B here. And the greater sciatic notch again is this notch. We pointed out the ischial spine again, and most importantly, this ischial tuberosity. It's a huge tuberosity. For reference point, I did do the acetabulum so you can see where that is. We do have the posterior iliac spines, but I'm not as concerned with you knowing those. Greater sciatic notch is much more important posteriorly.